Have you ever felt sad for a few days? Now imagine that sadness lasting for weeks or even months. That's what depression feels like. Today, we will talk about what depression is, its causes, symptoms, and the different types of depression. What is depression? Depression is a mental health disorder where a person feels persistently sad, empty, or hopeless. It doesn't just affect mood, but also thoughts and daily life. Unlike normal sadness, depression lasts longer and can interfere with school, work, and relationships. Causes of depression. Depression doesn't come from one single cause. It usually develops from a mix of biological, psychological, and social factors. For example, genetics can play a role if depression runs in the family. Brain chemistry also matters, since an imbalance of certain chemicals can affect mood. Stressful life events like trauma, the loss of a loved one, or financial problems can trigger depression. Medical conditions, such as chronic illness or hormonal changes, may also contribute. And finally, substance abuse like alcohol or drugs can make depression worse. Symptoms of depression. So, what does depression feel like? Common symptoms include persistent sadness or emptiness, losing interest in activities you once enjoyed, constant fatigue or low energy, changes in sleep like insomnia or oversleeping, and changes in appetite or weight. People with depression may also struggle to concentrate, feel guilty or worthless, and in severe cases, they may have thoughts of self-harm or suicide. There are several types of depression. First, major depressive disorder, which is intense and long-lasting sadness. Second, persistent depressive disorder, which is milder but lasts for 2 or more years. Third, bipolar depression, where people experience depressive episodes alternating with manic episodes. Fourth, postpartum depression, which occurs after childbirth. Fifth, seasonal affective disorder, where depression is linked to changes in seasons, usually winter. And finally, psychotic depression, which involves depression combined with delusions or hallucinations. Depression is serious, but it's also treatable. Therapy, medication, lifestyle changes, and support can make a huge difference. If you or someone you know is experiencing symptoms of depression, it's important to talk to a parent, teacher, or mental health professional. Remember, you are not alone. Help is always available.